Hi, Mr. Smith. How are you feeling today? My name's Emily. I'm going to be your student nurse. I'm just going to go ahead and perform some hand hygiene. I'm here to do my physical assessment on you. It's about to take about 25 minutes. Is that okay with you? Okay, awesome. I'm just going to have you verify your name and date of birth for me. Okay, fantastic. And can you tell me where you are right now? Okay, and why are you in the hospital? And then can you tell me what month it is? Okay, so patient is alert ×4. They are aware of person, place, time, and situation. Okay, patient appears well dressed, well groomed. It appears that the patient has just been washed. The skin is dry, the clothing is dry, and there is no irritation on either one. Patient has good posture. They are sitting erect. They have no issues ambulating by themselves. Their gait is steady. Okay, Mr. Smith, I'm going to go ahead and perform some vitals on you. Is that okay? Okay, awesome. So first, I'm going to start with my pulse rate. Okay. Okay. So the pulse rate is strong. I will give it a +2 on the scale, and I also counted the respirations at the same time. The patient has a respiration of 16. They show no visible signs of distress while breathing. There's no nasal flaring or any difficulty, and the chest is symmetrical with its rise and fall. Okay, I'm gonna go ahead and do your pulse ox really quickly, okay? And while I'm doing that, I'm going to take the patient's temperature orally, but if there was a reason I couldn't take the temperature orally, I could do a tympanic in the ear, or I could do an axillary temperature under the armpit. So the temperature was 98.6, which is normal. And my patient's pulse ox was 98, which is also really great. Okay, I'm just going to do the patient's blood pressure now. Pardon the noise. Okay. Right above the brachial pulse. Okay. Okay. So the patient's blood pressure was 120/80, which is perfect. Is that normally how your blood pressure looks for you, Mr. Smith? Okay, fantastic. I'm just going to take this off. I am going to leave it on his bed for now. Okay, I'm going to go ahead and just feel your head if that's okay with you. I'm just feeling for any bumps. The eyelashes and eyebrows are present, and there's no signs of lacrimal drainage in the eye, and there's no redness in the conjunctiva of the eye. So I'm going to go ahead and just feel your head for any massive bulges or look for any alopecia, okay? So I'm going to go ahead. Do you feel any tenderness when I touch your head? Okay, no. Fantastic. There's no signs of any masses or bulges, no hair loss, no redness, or no skin irritation on the head. Is there any tenderness when I press on your forehead? No? Okay. Any tenderness in the face? No? Awesome. Okay, so I'm going to go ahead and check your eyes for Perla. Okay. Okay. Okay, so the pupils were equal, round, and reactive to the light. And I'm going to go ahead and have you look at the pen light. Just don't move your head. Okay, and then I'm going to do the extraocular movement. So go ahead and follow it, but don't move your head. Okay. Okay, everything appears normal with the eye movements, and like I said, the Perla is correct. Pupils were equal, round, and reactive to the light. So I'm going to go ahead and check inside the nose really quickly. Okay, the mucosa has no redness. There is moisture inside there. The nares are present throughout the body, throughout the nose. And there's no deviation in the septum. All right, I'm going to go ahead and feel your nose. Take a deep breath in and out for me. Okay, in and out. And the patient is a nose breather. I have seen them breathe with their mouth through any exertion, but mostly the patient does breathe through their nose. And the trachea is midline to the body. I'm going to go ahead and look in your mouth, okay? The lips are pink and they're perfect skin color, matches with the ethnicity. There's no cracking in the lips. As I look into the teeth, there's no decaying of the teeth. The tongue is moist and the uvula is present. There is no redness or any signs of irritation in the mouth. Patient's skin is dry throughout the head. Everything's dry. There's no redness or irritation, and the skin color is perfect for the patient's ethnicity. So I'm going to go ahead and pull on your tragus. Let me know if you feel any pain or sensitivity to the tragus. Okay. Okay, I'm going to go ahead and look in your ear for any drainage or redness. Okay, everything looks good. I'm going to come on the other side to check your other ear. Okay. Any pain when I pull on your tragus here? Alright, there is no pain. Checking this ear for any drainage, and everything looks good. So I'm going to go ahead and take down your gown. I'm going to look at your chest, okay? Okay, I'm inspecting the chest for any masses, bulges, scarring, redness, or rash, but everything seems to appear good. I'm going to feel the 5 cardiac landmarks before I auscultate them. So the aortic point, I'm just feeling any bruit. Okay, the pulmonic point, Erb's point, the tricuspid point, and the mitral point. And then I'm also just going to feel your chest. Is there any tenderness when I touch on your chest? Okay, no signs of tenderness. So I'm going to go ahead and listen to the breathing and the cardiac landmarks on the chest. Okay, so I'm going to start with the aortic point and go down to the pulmonic point, to Erb's point, the tricuspid point, and the mitral point. Okay, so now I'm going to listen to your breathing, so I'm going to go ahead and have you take a deep breath in for me. Okay, deep breath in and out, in and out, in and out, in and out, in and out. We're almost there. Take a deep breath in and out, deep breath in and out. I'm gonna go ahead and listen to the base of your lung. Take a deep breath in and out, and take a deep breath in and out. Okay, awesome. And I don't see any use of accessory muscles when breathing, and the chest rise and fall is symmetrical. Everything sounds really, really good. Okay. Do you have any problem with any cough, shortness of breath, or any difficulty breathing in any position? If you lay down, do you have difficulty breathing? When you stand up, is there any difficulty breathing? Okay, awesome, that sounds good. I know I checked your pulses previously, but I am going to check them simultaneously, so I'm going to go ahead and just feel both pulses right now. Okay, the pulse rate is 85. Very good and strong pulse radiating throughout. Everything looks good. It is a +2 on the scale, and then I'm just going to assess for any edema. And I don't feel any edema on the arms, and no edema on this side either. And while I'm here, I'm going to go ahead and have you grip my hands. I just want to test your muscle strength. Okay, muscle strength is equal bilaterally. Fantastic, thank you so much. And I forgot to mention previously, I was going to have the patient look. Can you look to your left for me? Checking for any jugular vein distension when the patient moves their neck. Okay, go ahead and look towards me. I don't see any jugular vein distension. The neck appears smooth, so that looks good. And also, while I am up here, I'm gonna feel your, I'm just gonna feel the preauricular, the postauricular, the sinuses, the occipital, the post-cervical, pre-cervical, the tonsils, the submandibular, and the submental. Okay, awesome. And I'm just gonna have you go ahead and turn your head towards me, and I'm just gonna put a little bit of resistance on. Okay, and turn your head the other way, and I'm gonna put a little bit of resistance. Okay, patient has good range of motion of the upper extremities. And while I'm here, I am gonna have the patient abduct, so go ahead and take your arms away from your body. Okay, awesome, and bring them back, that's adduct. Go ahead and flex your arm for me. Awesome, and then go ahead and extend your arm for me. And then circumduction will be the round of the arm. Okay, so the upper extremities have good range of motion. Fantastic. So I'm going to go ahead and pull your blanket down. I'm going to assess your abdomen, okay? Okay. So upon first inspection, I don't see any distension of the abdomen. There's no scarring. There's no pediche, which is redness or rash. The patient's skin appears clean and dry. and the skin color matches up. There's no changes in discoloration. So I'm gonna go ahead and auscultate your bowels. Okay, so I'm gonna start in the right lower quadrant. I would listen for 1 full minute, but for the purpose of this video, I'm not gonna do that. I'm gonna go up, go this way. Okay, and the bowel sounds sound good. Do you have any problem with constipation, diarrhea, or any nausea? Is there any irregular discharge coming out of your genitalia? No? Okay, and the patient did have a bowel movement yesterday. The bowel movement was large and brown, and the patient's urine specimen was collected. It is an amber color, there's no cloudiness, and there's no odor. Okay, and I would assess the patient's genitalia, but for the purpose of this video, I did not, but the patient did state that there's no discharge, there's no redness, no irritation when urinating, and that he's having no problems with his genitalia whatsoever. Okay, so I'm gonna cover you back up. While I'm here though, I am gonna feel the femoral pulse. Okay, feels good. The pulse rate is still a +2 down here. And I am gonna assess the capillary refill of the fingers. Okay, and on this side. And everything is less than 2 seconds, which is awesome. Blood perfusion. Okay, so I am gonna come down here, so I am gonna pull up your blankets if that's okay with you. So again, the skin color looks good. There's no redness, irritation. The skin still is warm upon touch, but there is no signs of redness, irritation, or any signs of infection. So I am gonna go ahead and feel behind and feel the popliteal pulse. And the pulse rate is strong. It's a +2, that's fantastic. Go ahead and feel this popliteal pulse. And again, the pulse rate is great, +2 on the scale. Okay, and then I am gonna feel any edema on top of the tibia, because you have to feel any bony prominences to see if there's any edema, and there's 0 edema. Same with this leg, feeling for edema. Okay, and I'm gonna check your posterior tibial pulses. Okay, the pulse rate is still strong throughout. It's a +2 on the scale, and I'm gonna check the pedal pulse. Also good, the pulse is +2 on the scale. Okay, and I'm gonna do the same thing. I'm gonna check your capillary refill on your toes. There's no discoloration of the toes, and everything is in the place it's supposed to be. Okay, good, less than 2 seconds. Awesome. Awesome. Okay. And patient does have a steady gait when he ambulated to the bathroom. There's no signs of dizziness. There's no muscle tremors or muscle tics to be noted. We also did perform a Romberg test, and it was negative for our patient. Okay, so I'm gonna go ahead and have you press against my hands like you're pushing on a gas pedal. Okay, awesome. Muscle strength is equal bilaterally, and then go ahead and raise your toes back up towards you. Okay, and then can you point your ankles and toes outwards? That's abduction. We're gonna have you bring it back inwards. That's adduction. So everything looks great. That's fantastic. Okay. I've completed my physical assessment. Thank you for your time. Is there anything else you need before I go? Your call light is right here, okay? Thank you.